That's one of the paradoxes in healthcare. A single startup cannot change the system. Startups are opportunistic. Finding the right and supportive environment is really critical. It's good for business, but bad for people. I think is an important piece of the puzzle.
Hello all our viewers. I really encourage you to subscribe to our channel, and if you enjoyed this episode, like this video and share with everyone who might be interested in digital health content. Also, I'd like to remind you that the Russian-Ukrainian war is still going on. It hasn't ended yet, so please support Ukraine in any possible way. That really means a lot to us. And now let's get to our today's guest. I'm really excited to introduce Nick Guldemond. Hi, Nick.
Hello, hi.
I was really anticipating for this interview, and it took me a while to get through all your positions in multiple companies, organizations, universities. I don't know if I can use the word briefly, but can you just tell us some most important and most interesting facts about your experience, especially related to digital health, of course?
Mm-hmm. Yes. Thank you very much, Alex, and for the invitation and the interview. Yes, so Nick Guldemond. So my background is in electric engineering and medicine. And I think my interest for, of course, technology and digital originates from my, let's say, first education in sort of technology and use of technology. And I had a sort of idea to become a neurologist. But yeah, for all kind of reasons, my career in healthcare and medicine was a bit different. And I started actually in orthopedic surgery, which is also a quite technical discipline. Mm-hmm. And but it fitted well. And while working in the hospital, and I'm talking about early 2000s, I was also responsible for coordination some research projects, getting the funding in. I discovered very intuitively on how it works with industry, with other stakeholders from the outside, and bringing them into the hospital to build new projects. Mm-hmm. And similar a little bit within the hospital with and the university with different disciplines, to build something on ideas or problems, create a project, get the funding in, and get it done. And in a sort of organic way, it was a sort of first example of a living lab and creative environment. But all those words were basically not used or not invented yet, like co-creation, co-design, user-centered development. It didn't exist. Open innovation was upcoming. So that was an important development, which also led to a lot of projects related to digital. So through this sort of what was called the medical field lab, we did many projects in pharma, in medical device development, in service design, but also a lot of it in digital or early days monitoring of patients, sensor technologies, interfaces. So during that time, 2005, 2008, we started projects, for example, with Philips on the early days smart TVs as a sort of interface for example, elderly people or people with chronic conditions, to have a different way to support them, to monitor them, to give them information. We had a project because we had a collaboration with the Cleveland Clinic in the US, and they collaborated with NASA. So we used sensor technologies which were used for monitoring astronauts in the clinical environment. To give you some of the examples, also the telemedicine for cardiovascular patients, they already existed, but equipment was a bit bulky, the interfaces were not as smooth and as nowadays. And gradually I moved more into, let's say, overall strategies for innovation in clusters, regions in Europe. I became more involved in European collaboration, but more on a strategy level. And that increased through international collaborations, also for multinational companies, and university collaborations. So that led to platforms, app design, supporting startups, while basically always working from this sort of more academic angle, but with sort of close connection also with the application, a bit in the business, a bit in the policy. So I'm supposed to sort of multifunctional tool, a Swiss Army knife, which I can use this different experience into typical challenges or problems.
Very interesting. Seems like what you said in the very beginning, you were kind of creating startups even before people started calling them startups and before it started to be mainstream. Also, you were a mentor of the accelerator Rockstart. Can you tell us some of the examples of what kind of startups were you mentoring?
Yeah, well, I should say, so that was quite interesting because I joined because I have this idea, okay, how can I help to improve healthcare? And at the time, also startup was quite booming. And I thought, well, maybe I can have a contribution and also to learn startups more from a healthcare system perspective, how healthcare systems work and what could be the sort of implications for startups. So there were a lot of startups who pitched their sort of idea and where we had a sort of reflection, okay, looking at this particular applications, these and these are the sort of opportunities and challenges. So there was, let's say, not a single topic, but there was in robotics, social robotics, AI, language-based solutions, to more platform type of support services involved. I should say I stopped there. Not because it was not interesting and inspiring with the startups, but in Rockstar as a sort of institution for training those people, it was a way. So they are very, let's say, startups are opportunistic. So you tell something, they consider it whether it's useful or not, and then they are gone. So there is no, or for myself, in the sort of way I work, is more in sort of longer term planning, more of course as systems, and so usually the implication I tell are more, let's say, I think complex or difficult. So they easily move away and do something else, which is fine. But I thought, well. At this phase within the training, I saw, well, it is not so effectful as me as a mentor. I think they are in different phase, different context. So I stopped the collaboration. But I think initiatives like Rockstart are very useful to learn, let's say, the basics of startups. But it was quite interesting.
Okay. I really want to talk a lot about multiple healthcare systems around the world, but let's start with the healthcare system in the Netherlands. Can you maybe give us a short overview of how the healthcare system works here in the Netherlands?
Yes. Well, the Netherlands healthcare system is... In terms of how it is organized, so it's you have defined, let's say, aspects as a patient where you go through the system if you have a problem, from primary care to hospital and more specialized care. You have social care aspects as well, but it is very primary care oriented, which is an asset, I think, in terms of effectiveness of a system. It's everybody should have an insurance, And you can choose this from different insurers. And also you can choose your, let's say, your healthcare professional, but you should keep to this sort of process, first going to the family doctor. Family doctors refers or solves the problem themselves at the primary care level. So in a brief on how it works, people can, through their insurance, get reimbursed, usually automatically, or otherwise they have out-of-pocket payment which will be reimbursed. In terms of solutions, it's a bit more complex, especially when you look at digital health. So although there are some facilities, instruments to use digital solutions, the uptake is not yet not so much as it could be. It's also very fragmented. Healthcare professionals don't have a real good overview on what solutions might be available, nor the people, the patients. And inherent a little bit to our system, which is still very, I think, fragmented. Also, the digital solutions are very fragmented. The way of reimbursement, it differs from insurer to insurer. And also they are not yet so much involved in the support of these solutions. While there are some insurers who are more ahead than others. But there is no alignment. And for people typically, had to understand, okay, for my type of problem and how solutions might work with an app or other kind of digital service, it's not so very clear, which accordingly, prevents the sort of proper uptake at the scale we basically use to improve our healthcare system.
Mm-hmm. Okay. If I ask you to, since you've been traveling a lot around the whole world and you've been following lots of changes and improvements in different healthcare systems, if I ask you to choose one healthcare system as a role model in the whole world, which one would you choose?
Yeah, well, it depends a little bit whether you ask from a digital health perspective or more in general.
Let's start with more in general first.
Yeah, I would say many countries, or almost all countries, do have specific, let's say, things which are really going well for people, but also a lot of challenges. Though regions within countries, there are some regions who really stand out. Let's start with the US. US is a healthcare system which is overall is very bad performing. The amount of money spent and the quality is really bad value for the. It's good for business, but bad for people. Yeah. But an organization such as Kaiser Permanente is doing very well in a very integrated service. Very people-oriented, good collaboration between all the aspects of healthcare to make it work. You have in Spain regions like Catalonia and the Basque Country who do really well on how to organize it as a system, similar as, let's say, Kaiser Permanente or other integrated systems. Singapore is a really interesting country. Of course, limited in the sort of size of number of people, but pretty much integrated also use of data. And give a more exotic example. I think Cuba is the way how it's organized with very community-oriented care, a lot of prevention, a lot of social elements embedded in the sort of approach how to help people is really also a wonderful example, and how they invest in professionals, in quality. So for this you can mention also for many other countries on with regions or let's say more overarching organizations who perform really well. accordingly, we can learn a lot of lessons and we can use it to improve. And collaboration in healthcare is really important to make things more sustainable. If you look from the digital angle, then then in Europe, for example, Estonia is always mentioned as a really integrated digital, let's say, environment in which data can be exchanged. People are used to sort of a digital environment to receive or use public services and healthcare. So that from a systems approach for healthcare system, which I'm typically interested in, is that a very good example. They have still some challenges as well with digital services and with exchange of information between different organizations. But it's from a systems level, it's really good. If you look to how to use data for segmentized patient groups and accordingly providing very dedicated services, there's quite an old example already for 20 years, which is Kinzigtal, which is in Germany, in the south of Germany, western part. And they have a really population-based sort of data use to align their services. I was very impressed by China. Of course, huge country. I think very typical in China is they lacking primary care almost completely. As an alternative, they over the last years they built platforms which are a sort of alternative for the first access to healthcare in a sort of primary care logic, where you screen the sort of problems people have, you try to solve them in the most simplest way, rather than go to the hospital and do all kind of complex diagnosis, which typically happen in China. There is an overflow of patients who run to the hospital with even the simplest problems, which creates a lot of problems. And you have their hospitals like beds with 5,000-6,000 beds, which is huge in terms of how to manage. And still they can't cope in these larger cities. So they have to use this sort of more integrated platforms. We support with diagnosis, with sort of clinical reasoning, finding a sort of intervention, and do some follow-up. There are different platforms, but there we did some evaluation of some platforms, and there you saw an efficiency gain based on data about of 60% caseload efficiency, which is huge. About 40% of cost reduction. Still, we are still trying to test the sort of reliability of this data. There were some negatives as well in the way how it worked, but that shows really in terms of digital, and I'm talking about for a particular platform about 300 million consultations a year, which of course is huge. So that was also quite impressive on how they do this on a super large scale, serving a large number of people.
Going back to Germany, what's your opinion about DiGA and the whole fairly new reimbursement system? Like I know that France is looking after it and want to apply in their country. Some other European countries probably do the same thing. What do you think? Is it a good thing, bad thing, or is it developing in the right direction?
Yeah, I think it's one piece of the puzzle, because proper reimbursement and also that people can find the right solutions, or that a professional can prescribe solutions and get reimbursed, I think is an important piece of the puzzle. The complexity is with digital. If digital wants to be successful in a large scale in a system, you have to change many things. It's not just only a matter of having a sort of overview of solutions. It's not a matter only of having the proper right reimbursement or have the proper regulations. the challenges are more on how the system function in terms of service provision, how the people are providing in a different way care with digital solutions. That's much more challenging than these aspects. So I think this development is good, but the overall, let's say, conclusion is it doesn't gonna work in a very successful way if you don't do all these other things.
Since we started talking a little bit about finances, there is a statement that the technology is here to bring better value at lower cost. And if we're looking at the US market, there's lots of innovation there already, lots of startups. Actually, healthcare providers are starting adopting those technologies, but it doesn't seem the cost is going down. Why do you think this is happening?
Yeah, so if you look typically to the US, it's a very profit-driven system. So many actors in the system, they are focusing on making money rather than the cost effectiveness. So how to, but not per se that they want to do harm to people or whatever. But yeah, it's how systems work. If you make the system optimized for making profit to all kind of actors, they will do more instead of doing what's right, and which might also include that there will be a sort of less income generated because of that. Because most of the time you shouldn't do a thing. Issues can be simply solved. So it's typically a profit-driven system tends to increase overdiagnosis and overtreatment for those who doesn't necessarily need this sort of treatment. So this is an important cost driver. We know that a lot of, let's say, cost efficiency is achieved by collaboration, by integrated care, because you will have better outcomes rather than focusing on repairing one simple issue, and then the other things still remain still a problem. For example, in oncology care, if you're focusing on removing or attacking, try to treat a tumor, usually there are all kind of other aspects which might be relevant as well to take into the sort of improvement of the overall outcome, and accordingly also the healthcare consumption. For example, psychological problems. Technology solutions, they help to a majority just only increase the sort of overdiagnosis and overtreatment. That's one of the paradoxes in healthcare. So if you provide all kinds of solutions, which tends to provide us to do more, then you get a cost rise. So that's one of the most, let's say, together with the sort of financial model they have, the sort of increase of costs.
Okay. What other problems in digital health can you mention right now around the world?
Well, so following the previous statement, so we know that the most of the challenge is how to make the system integrated. It is a fragmented system, so there are only single problems are solved, or maybe part of the problem. And accordingly, you keep this, let's say, low-value care. While if we want to be more preventive, we want to have better health outcomes for lower cost, you need integration and more also integrated solutions for that. Diagnosis, prevention, treatment, rehabilitation, etc. Overall, so we most countries do have a problem with this sort of change from a fragmented system to an integrated system. That applies for finances, that applies for services, sometimes regulation, but also for the data. So if you for a single startup and you deliver a good solution, for an aspects of care, and the solution is not well embedded in the service environment with the related finances, and the people don't tend to use this in a sort of integrated way, it will not be so successful. So that is one aspect of the challenge.
But the funny part is that we as a startup founders, investors are telling us, go there and solve specific issue. And I agree, startup founders don't usually think and don't see the whole picture when they're solving some specific problem. And this is I don't know how to solve this, because it's really hard for a small startup to get integrated with the whole healthcare system, whatever country he is operating in. And I'm not sure how to fix this at the moment.
Yeah, that's absolutely true, and that shows also the complexity. So what, for example, in the Netherlands, we also had this sort of startup environment. We have organizations supporting this environment, and sadly, they don't want to talk about the system change, because you have to make changes in the system to make the adaptation of these solutions work. So and of course, a single startup cannot change the system, usually. So you need some changes on how we organize the adaptation of these solutions in a system. The implications for the system, typically the government and the actors, is quite huge. It needs an overall strategy. So typically this is where I'm try to improve and discuss on what should be done, but because the implications for all the actors at the public side, for example, is huge, usually they find it very difficult. So it's not very easy. But if I'm talk to startup communities, etc., and you should stop talking only about the money and getting the investment, but get into dialogue with healthcare ministers and etc. on how can we together create, on one hand, the startup community as a sort of engine for delivering of solutions, but also how can we make the system more to adapt these solutions in a proper way. So that points to the complexity. So I made attempts several times to discuss, okay, if you really want to make startups more successful in such an environment, we have to work together. But well, at least to my opinion, I see too little, let's say, effort from these communities in discussing more, okay, we as startups, we need a system change. How can we work on this together in a sort of sustainable way, including also investors? And that I think also for the Netherlands is typical. It's a bubble which doesn't seem to be able to connect with the sort of policy environment world where I typically work. And we have to solve this issue in order to work on improvement.
It's apparently the digital health revolution is on the way right now, and it's going. Do you think, I think it started probably when you were starting your career back in 2000. Where do you think we are on this curve? Are we still going up or of this revolution, or not really?
Well, so on many aspects, you see progress on how technically things are integrated, etc., and solutions, so that there are, I think that's encouraging. So obviously the crisis pandemic also make the sort of awareness that digital could help and be an alternative to provide care was very it's very hopeful. I think where are the concerns is that so the problems are usually not coming as a single thing. Usually, like we now experience, we have many problems, also geopolitical, healthcare, staff shortages. We have an increasing demand, and we saw also had the sort of economic crisis. So many things come now together. So in order to make effective changes, and typically the things we discussed in the previous questions, this needs leadership. It needs a comprehensive approach. While there's a tendency, of course, when people are in a crisis, they tend to focus and not keep this and follow their own interest. So I think we are in a critical phase where we either we work in a more, let's say, comprehensive. We keep the sort of vision on how we should collaborate with the different actors to use this power for, in Europe or further, on how to work on typical system problems in order to make also the more single problems solve. So it's a typical multi-complex, multi-level problem. We need alignment on the different levels: policy level, professional level, societal level. So that's I'm also concerned. Also, for example, if I look to the Netherlands on how the current government is addressing typical issues, and Netherlands is a typical country which have all the resources. We are incredibly still rich. We have a lot of resources, infrastructure, etc. Still, the leadership and also the willingness to really collaborate together in order to solve things is lacking, and also in healthcare. And I do get a lot of, I think, inspiration, especially from Central, Eastern, and Southern Europe, because they have their specific challenges. But I see really good things happening there as well. So I think we should not look only to, let's say, the established healthcare systems and how the US, the Netherlands, or the UK, or the Scandinavians are doing. But we should also join forces in countries like Bulgaria, Romania, Ukraine, Moldova, Armenia. I think there are a lot of talent, a lot of opportunities also to make maybe steps who really can improve for a lot of people with relatively simple measures. So I think also for digital, there's a lot of opportunities there, because also things are a little more flexible. Not always easy, but flexible. While in countries where everything is so fixed and rigid with policies like the Netherlands or France or Germany, it might look like sort of attractive environment because there's money, but in terms of making real things work, it might be due to other factors very rigid.
Very interesting. At the very end, I usually ask our guests to give some recommendations to startup founders in digital health. You've gave quite a few already when we talked about changing the system, not just specific problem and integration to the system, also not to chase just for the money. I think that's a good one. Maybe anything else? What other recommendations could you give?
Yeah, well, considering that usually for a solution, you need this context with how a sort of system works with the different actors, is really vital to at least prove some success. And this is sometimes provided by some sort of ecosystem or environment. But I think, though, there are some of these communities who are claiming so supportive and successful. I think, there are not so much good, effective clusters in this respect. Like the Rockstart environment here in the Netherlands. I think at the beginning they said, well, you have access to a clinical environment and doctors. I think no startup application was ever tested in those years, in the last, let's say, 6 years. So there is a lot of marketing, etc. So for a startup, finding this sort of micro environment by which you can develop and test products, and also at a sort of actor perspective, if startup being more, let's say, not so optimistic, and that they're here today and gone tomorrow, because also you see a lot of, I think, tiredness with all these people who come, yeah, I have the solution, let's work together, and then people invest their time in making it work, and then suddenly there's something else because someone else is promising more or whatever. So this sort of optimistic behavior, I think it doesn't work. So it requires a sort of balance of sort of a loyalty towards each other. Finding the right and supportive environment is really critical. And this can be partly done maybe to some of the networks available, but it's partly also establishing these more reliable, bit more long-lasting relations, really partners to develop.
Very good. I think that was really interesting. Thank you, Nick, for this great interview.
Thank you, Alex, and my pleasure. Thank you very much.
Thank you.
Yeah.
Bye-bye.
Bye.